Hello, Jakarta and the world. This is White Trash Talking. I'm Doug Johnson, and I'll be talking to you about issues relating to Jakarta, the U.S., and the world. As a U.S. citizen now living in Jakarta, I touch on issues relating to the West and the East, the United States and Indonesia, and to the world events in general, because everything is related and interconnected. Hello, everyone. So today I'm joined by my wife, Dia Paramita, and hello, Mita.
Hello, thank you for having me.
My pleasure. This time we're going to talk about Mercury again. This is the second part of a two-part series. The last time we talked about the prevalence and danger of mercury in the environment in general, but this time it's mercury in dentistry specifically. And we both have some experience with this, actually a lot of experience, and we went through quite an ordeal, which we want to share with you now. So let's start with the history of dentistry, the history of mercury in dentistry. Can you touch on that?
Yeah, so it was started at around 1816 and 1826 when the French dentist Born introduced the amalgam or mercury amalgam filling as a dental restorative materials. So back then there was no institutions that oversee this, the safety of dental restoration material such as mercury amalgam. But however, in 1845, there is a American Society of Dental Surgeons where the members were concerned about the use of amalgam filling, and they signed a mandatory pledge promising for the dentists not to use mercury amalgam fillings because they think that there is a toxicity from the materials, and then also they think that it is a malpractice of using mercury amalgam for the patient.
I mean, clearly mercury, as we talked about in the first part of the series, mercury is toxic.
Yeah.
I mean, there are protocols about putting mercury in the ground, right?
Yeah,
can you do that?
Yeah.
Can you put mercury in the ground?
No. It's because of the toxicity. There is a protocol on how you store the mercury in the ground, and then how you,
So you can't just throw away mercury.
Yeah.
Yet they
put mercury in your mouth.
Yeah, they put it in your mouth. So anyway, continue.
Yeah. So, unfortunately, at around 1856, the American Society of Dental Surgeons was replaced by American Dental Association, where the members of the American Dental Association were pro the use of amalgam filling.
Now, was this replacement due to the disagreement about mercury?
The disband? No, I'm not really sure, but I guess the American Society of Dental Surgeons were disbanded.
Okay.
I don't know the
All
reasons,
right.
but then the member of the American Dental Association, they agreed of the use of the mercury filling, and that's why.
Why would they do that?
There are several reasons. First is considered as cheap, and then the second is strong, and then
and it's easy to use.
Yeah, it's easy to use, and also there is no, it's difficult to prove that there is a direct health impact from the mercury filling because it takes several years, and also every people may have different symptoms. Yeah. So then they will just even though there were no study. They were considered it was safe to put.
Or they made themselves believe it was safe.
Yes, yeah.
Because any intuition would tell you that it's not, because, I mean, come on, it's mercury.
By itself, by itself is very dangerous,
Yeah, so, I have a history of mercury. I've had a lot of mercury in my mouth. And what I want to do is just go through the timeline of my experience, because I think it's very telling, it's very instructive. So I started going to the dentist when I was about 6, along with my 2 older brothers. And from the years 6 to 12, we went twice a year. My mother believed in good dental health care, and her father was a dentist, my grandfather. So she grew up just believing in preventative care, which I give her credit for. And so back then the ADA recommended that everyone go twice a year. And so she took us 2 times a year. And every time we went, we had cavities. Cavities are decay of the teeth. And every time we got fillings. And this was always in the molars, not in the front teeth, not anywhere else, but just the molars and the flat part of the molars. And as the years went by, from the ages of 6 to 12, my molars filled up with mercury. I had rows of mercury on each side's tops and bottoms. Then one time my mother took me and we went to the dentist, and she talked to the receptionist there and chatting and stuff, and they found out that she knew a little bit about working in a dental office because she had helped her father when she was a girl. And they hired her. They said they were looking for someone, and so she started working for them immediately. And suddenly, I started having no cavities. And, all the years, 2 or 3 cavities each visit, without exception. A dental visit meant a cavity, without exception, ever. And my brothers, too. I know this, because we went at the same time. And then suddenly, my next visit, there was no cavities. And I thought, wow, this is great. The visit after that, no cavities. And so from the time I was 12 until I was 64, which I'm 64 now, I never had one cavity, never had any fillings put in my mouth, except this year. I did have some tooth decay, but it was for a specific reason. Anyway, so, it got me thinking, well, why would I suddenly stop having fillings? Well, I thought about it, and my mother, one of the benefits she got from working at this dental office was free health care for the family, meaning free dental visits. And the dentist was not going to do work that he didn't need to do. It let me know that the conclusion I came to is he had been drilling good teeth.
Yeah.
During these years.
To get money.
Yeah, because it was what's called the drill and fill era, where dentists drilled teeth, filled them. That's how that was their bread and butter.
Yeah. And you can Google it. It's very...
Yeah.
Yeah.
I mean, now they have root canals and they have implants and they make a lot of money that way. But back then, if you didn't have a filling or 2 or 3, you weren't making much money from your patients. So I think it was a widespread practice. They drilled good teeth, and no one ever got a second opinion. So it just was never discovered. And so after that, I never had any cavities. And then in my 30s, my teeth started to, because mercury expands, my teeth started to break apart, to crack first. A little piece would break off, and over time it would break apart. And so I had to go to the dentist, and then I had ceramic crowns made, these coverings that go over the remains of the tooth. And this went on, most of my molars were covered with this now, and was turning into a real expense by that point. And then one of my last visits was when we lived in Iraq, and the dentist was working on a tooth that had some mercury filling still remaining, and she drilled into the mercury.
Yeah.
And when you drill into mercury, you create an aerosol, and the aerosol goes into the sinuses and your lungs, and you swallow it, and the saliva and everything, and a large dose of it. So within 48 hours, I woke up thinking I was having a heart attack, severe arrhythmia, crazy heartbeat, like I'd never had in my life. And we had to wait for the hospital to open, so Mita looked online for the cause of this, and she decided, well, we need to do a blood test. And it could possibly be related to my thyroid, because the heart function is determined, the heart and thyroid are connected.
Yeah.
Let's put it that way. I'm not an expert on this, but so we went to the emergency room. We went to a heart specialist. He diagnosed me with heart failure, yet he never did a blood test and never looked at any other possible causes. And so we did a blood test, and we determined that it was the thyroid.
Yeah.
And we're not doctors, but Mita did this, and
and we went to endocrinologist to consult further, and then even the endocrinologist said that, oh, I'm sorry, you really misdiagnosed, because you were diagnosed as a heart failure.
And at that point, I was losing weight, and rapidly. And like in a week, I could lose, a few pounds.
Yeah.
And I was eating the same, but just my thyroid it's hyperthyroidism, so I was working overtime. And I had brain fog. I was having trouble at work, and memory issues, severe anxiety, trouble sleeping. And I began to develop allergies, and particularly to mosquito bites. And to this day, I'm plagued with that. Severe reactions to mosquito bites.
Yeah. And even the doctor said that you have autoimmune problems.
Yeah. It's Graves' disease. So, and I probably have that for life. And I was on medication. Started with a beta blocker. I took neomercazole, and was on that for several years until I kind of weaned myself off of it, and I got on a healthy diet through the consultation of a doctor in the UK, a really specialized diet that began to repair the damage to my gut.
Yeah, but also you went to Spain to remove the remaining of the mercury safely, because it has to be done
That's
safely.
Right.
Yeah.
That's right. All around the same time. But I just wanted to, so I don't forget, so when you have mercury poisoning, the tooth emits a vapor 24 hours a day, 7 days a week. The vapor is coming off the tooth, especially when you chew. It gets into your sinuses, it gets into your saliva, that goes to your gut, and it affects your digestion and overall health. And people are made differently, so they react differently to this.
Yeah.
And some of the diseases are, and this is shocking, but I just wanted to go through this. Alzheimer's disease, Parkinson's, multiple sclerosis, Lou Gehrig's disease, cardiovascular disease, infertility, neurological disorders, immunological disorders, kidney disease. And most people don't know this. This is a profound, it's mind-blowing. So we'll talk about that, more about that in a second. But like you said, Mita, then I ended up going to Spain and having my mercury removed safely. Could you talk about that?
Yeah, it's very important to, when you have mercury and when you to remove it, it has to be done safely. The International Academy of Oral Medicine and Toxicology, or IAOMT, have a protocol. The name is SMART, Safe Mercury Amalgam Removal. So, for example, for the dentist, you have to have your own safety apparatus, safety protective equipment, such as masks and the mercury vacuum that can suck the mercury vapor from your mouth, so it's not really contaminate the air. And then also for the patient itself, there is a set of safety equipment, for example, the oxygen, and then the dam, the rubber dam.
Dental dam, yeah.
Dental rubber dam, and then also a cover so that like the mercury debris is not going to your body. And also like I think after the removal finish, you will be suggested to take selenium because selenium binds with the mercury, so it reduces the toxicity just in case there is mercury that goes to your system like that.
Yeah, and the protective gear is also for the dentist.
Yeah.
In fact, this mercury amalgam in the patient is very, very dangerous to the dentist because a dentist could have multiple patients a week, patients of my generation or even of
My
yours.
generation, yeah.
They're coming in for visits and opening their mouths and mercury vapors coming out, and when they start working on the tooth, they're susceptible to the dangers. And if they try to remove mercury or drill into mercury, it's just as dangerous to them as it is to the patient.
Yeah, you're right. Yeah.
And historically, it's interesting. I mean, I can't say for sure, but what I do know is the suicide rate for dentists is higher than it is for other professions. It's abnormally high. I attribute it to mercury exposure. And that's, it could be for other reasons, but that's very plausible that it's mercury related. And I talked to my doctor in Spain where I had my mercury removed, and he did it with the proper protocols. But he told me that when he was in dental school, that his colleagues and he did not know about the dangers. And he ended up going into surgery, so he kind of got away from it, and it saved his life because his colleagues were all dead.
Yeah.
And what they would do is, back then they had the mercury in bottles. That's how they would get it. They would mix the mercury in their hands, and it would go through the skin and poison him that way. And he had one colleague that used to sniff the bottle, and he was dead within 6 months. And they didn't know why then.
Yeah.
It was never determined. So, yeah, it's been a real problem for dentists, and I think it still is. I think there's a lot of dentists, particularly maybe in Indonesia, that don't know.
Yeah. Probably most of them don't know, although like I think you were involved in some webinar and also like meeting with them, discussion to disseminate the danger of the mercury.
I was attended by a number of dentists and health practitioners, and one question that I was asked was, how do we know that it affects the organs in the body? And what I did was I just showed them a short video from Dr. Boyd, who's a researcher, scientist from the University of Kentucky. And this is a man who early on exposed the dangers of mercury amalgam, and he was shunned and silenced by the powers. Was he driven out of his job? Was he?
Yeah. The funding for his research were cut.
Yeah. So, but one study he did is he was able to show through a special kind of filming process the emission of mercury, and you could actually see the mercury vapor coming off of a tooth that was taken out of a mouth of a patient. Yeah. And I showed that. It's about a 30-second video. Anyone can find it online. Just Google mercury amalgam vapor tooth emission. Say any of these keywords, it'll come up. And I showed that, and there was kind of like a silence in the room. I mean, a gasp almost. Because, early on, I mean, maybe in my 30s, I began hearing that the mercury was dangerous, and maybe you should have mercury removed from your mouth. And I think to many people, it's an abstraction. It's not a real present danger, something that's urgent. But it should be treated with urgency because a poisonous gas is being released into your mouth and your body and causing diseases, some that I just mentioned. And these are some of the leading diseases.
Yeah.
I should have put cancer on there because it's linked to cancer as well.
Yeah, and mercury is basically a neurotoxin, so
Yeah.
it's very harmful for the neuron, so that's why it's very dangerous. Yeah.
And it's on the meridian chart for acupuncturists.
Yeah.
And so it's each tooth is on a different meridian, and it's connected to different parts of the body. And they've found that if you have mercury amalgam in specific teeth, certain problems will show up in certain parts of the body. And breast cancer is one.
Yeah.
And a particular tooth, the left side of the mouth for the left breast and the right side for the right breast. And I know this sounds outrageous to many people, but you should Google it, you should read up on it. The body is connected. You know, there's no reason to think that your teeth, where everything enters the body, is unrelated to your overall health.
Yeah, that's correct. Yeah.
So do you want to say anything more?
Yeah, I think this is to see the relation between organ is not only for the dentist, but I think also for the doctor in general. Maybe you have a patient come to you, then maybe it's important to find out whether how's the dental health of the patient, you know, whether they have dental amalgam or maybe they have root canals, and in other occasion we will discuss about root canals.
That's right.
Yeah. So because as you said that our body is not independent but is interrelated.
That's right.
And it's very important for us to find the root cause of the problem, not treating the symptoms.
Yes.
Yeah.
Yeah, and I've become very aware of this connection, the holistic aspects of health. And I had one friend who died of multiple sclerosis, and at the time I didn't know about amalgam, but she was my age, a little bit older, and she had a mouthful of mercury, and I just, just time and time again, I think, what if I could have just told her? Not many people will listen to you, but I think she would have listened. I also have a former student who now has MS, and she has mercury amalgam in her mouth. I know because I did ask her, but I'm not a doctor, so people don't listen. They're very skeptical, and you should be skeptical, and you should inquire. But it's very frustrating to me when I think I see a possible way to help someone and they're not open to it. So and then we've talked to people in Indonesia, groups. They come together because they're all suffering from problems of mercury and some of these illnesses.
Yeah.
Do you remember,
I think it was a webinar or something.
It was a webinar, yeah. So what were their complaints?
I think autoimmune problems, and then I think thyroid. Some of them have thyroid problems, and they didn't know what is the cause. They just have this problem. So then I think we share our experience. Yeah.
Right. Some of them had a little bit of knowledge, but then, I got in there and shared my experiences and showed the direct correlation between mercury and some of the symptoms that they were experiencing. They all had mercury in their mouth, every one of them.
Yeah.
So what's the problem here in Indonesia is they have no one to go to.
Yeah. Because I think the phasing out of the mercury amalgam is just recently in Indonesia because we just signed the Mercury Convention. But maybe overseas, like in Europe, the mercury amalgam has been prohibited for a long time. But for Indonesia, it's quite recent.
But there's no one here to safely remove mercury.
Yes, because of it requires training and it requires equipment that we have to be imported. And unfortunately, the dentist and the health industry doesn't want to invest on that.
Yeah.
Yeah.
Because they don't know.
Yeah, and also, I think their paradigm is so difficult to be, like penetrated because they've been using this for a long time.
That's right.
Yeah.
It's normalized.
It's normalized, yeah.
Yeah, and like I said, I began to hear that mercury was dangerous, but I thought, yeah, it is. It's better not to have it, but I've got it in my mouth, and I'm okay, So I was an athlete. I thought, but looking back, I started having symptoms right away. When I was a little kid.
Yeah,
I had my tonsils out, and I had severe depression. That's one thing I forgot to mention. Throughout my junior high school and high school years, I was very, very depressed.
Yeah.
What do I attribute to? I mean, it's very likely it was mercury.
Yeah, and also, isn't it tragic when there is a mercury, we want to dispose mercury, we really have to dispose it safely, we have to treat it there, and then if there is a mercury, the mercury thermometer broke, then the whole room have to be evacuated. But then,
well, how do you handle? How would you handle the mercury if the thermometer broke?
Basically, you have to be evacuated.
Yeah.
And then you have to collect the mercury, but there is a specific equipment for that.
Yeah. And then do what with it?
And then you contain it in a very safe container.
Like, what's that mean? What kind of container is that?
It's made of metal. We call it flask.
Okay.
Mercury flask, yeah, or a bottle that is not easy to break and also is not leaking.
Yeah.
And then you need to, basically seal it so that it's not evaporated.
And then where does it end up?
It should be treated by a specialist company that can stabilize the mercury.
Okay.
Yeah.
So this is extreme protocols for handling mercury.
Mercury, yeah.
And yet, the ADA said, well, it's cheap, and it's easy to use, and it's strong. You can just go ahead and put it in someone's mouth.
Yeah, and
you can't put it in the ground. You cannot put it in the ground, but you can put it in someone's mouth.
Yeah.
And we accept that.
Yeah.
We accepted it.
And I think also it's based on the false premise that, so the mercury is mixed with the copper. So it's not solely.
So why don't we just mix it with copper and bury it?
Yeah, and bury it and put it in your mouth.
No,
and this is also tragic because some of the people, they have heavy metal allergy.
Yeah.
Yeah, so mercury poisoning and also allergy to the copper, for example.
Well, and people will have gold fillings, which I did for a while.
Yeah.
And they'll have metal implants, titanium implants. And you can really exacerbate the problem.
Yeah.
And so
disaster, yeah.
I mean, I hope that people continue to evolve because we are evolving, but I think it's scary to see what health professionals do because we trust them. We trusted the ADA, and I believe that they knowingly let us down.
Yeah.
I think they knew, but it was just cheap and easy and profitable.
And then just silently passing out without, responsible to the cost that they cause to the health of the patient.
Yeah, they'd phase it out, but never take responsibility. They're not dentists aren't contacting old patients and, and so many people are out there, they're sick and they don't know why and they don't know what to do.
Yeah.
All right, so if you have mercury amalgam in your mouth, it means the mercury is silver, it's darker in color. You need to have it removed safely. With the proper protocols. And who can do that for you? Who would you turn to for advice?
I went to visit dentists that have IAOMT certified.
IAOMT.
Yes.
IAOMT. And you can find it online, just Google it.
Yes.
they're the best dentists in the world, and they're holistic, meaning that, you know, that they don't separate the mouth from the body.
Yeah, and also they are very mindful for the material that they use for
That's right.
dentistry. Yeah.
Okay, well, I think we'll just call it quits there, and this has been a good episode. Thank you, Dia para Mita.
You are welcome. My
Yeah,
pleasure.
we've been through this together, and
Yeah.
I couldn't have made it through without you. You've steered me in the right direction numerous times and supported me and kept me alive, basically. So thank you for that.
You're welcome. I also learned a lot from this.
Yeah. Okay, well, that's it. So join us next time. This is White Trash Talking. I'm Doug Johnson with my wife, Dia Paramita. I wrestle with the truth and sometimes lose. See you next time.